Okay, I'll say hello and welcome to everybody to this, our CBS-SCB event for National Health Ethics Week 2021. My name is Kevin Reel and I'm the president of the CBS-SCB. Before proceeding, I'd like to ask that each of us reflect for a moment on the land on which we are currently situated, to express gratitude for what the land has given and continues to give us, and to recognize the Indigenous peoples who've called this land home for millennia and who continue to call this land home. Please also consider how we can bring about meaningful change and reconciliation through our own practice, as individuals and within the organizations of which we are all a part. I'm very glad to say that we aim to host more events like this to bring those of us in the bioethics sphere in Canada together to learn about and discuss matters of mutual interest. I'll say about a bit more on this after the panel discussion. Now I'd like to introduce our guest speakers for today's session. Alnor Nenshi Nathu has been the Executive Director of the Alberta Health Services Clinical Ethics Service for the past 8 years. Prior to this, he was Executive Director of the Provincial Health Ethics Network of Alberta. He has previously served as the President of CBS-SCB and is a recipient of the Canadian Bioethics Society's Distinguished Service Award. His areas of focus in ethics are justice, social justice, resource allocation, and global ethics. Jocelyn Downey is the James S. Palmer Chair in Public Policy and Law, Professor of Law, and University Research Professor in the Faculties of Law and Medicine at Dalhousie University. Jocelyn works at the intersection of healthcare, ethics, law, and policy. Her research bridges bioethics and health law and has been focused on assisted dying, but like most people in bioethics, she also has worked on a wide range of issues, including research ethics, women's health, organ transplantation, and most recently, pandemic ethics. Jocelyn is a member of the Order of Canada, a fellow of the Royal Society of Canada and the Canadian Academy of Health Sciences, a past fellow of the Pierre Elliott Trudeau Foundation, and a recipient of the CIHR Bearer Flood Prize for Health Services and Policy Research. Bashir Jawani has been the lead ethicist and executive director of Ethics and Diversity Services at the Fraser Health Authority in the Metro Vancouver area for 16 years. He is the current incoming president-elect of the CBS-SCB and has previously served as the treasurer for the organization from 2003 to 2009. Through his work, Bashir and his team's overall goal is to support patients, care providers, and members of the public to improve their quality of life and live with greater integrity through their engagement within the healthcare system. Alnor will start off with his comments, followed by reflections from Jocelyn and then Bashir. And I'll now hand things over to Victoria Segal-Klein, Membership Officer of the CBS-SCB Board, who will be the moderator of today's event. Victoria.
Thank you very much, Kevin, and welcome everyone. Happy National Health Ethics Week. As Kevin mentioned, I'm Victoria Segal-Klein, the Membership Officer on the CBS-SCB Executive. I'm also a clinical ethicist in Alberta Health Services and will be the moderator for the session today. I just want to start off by providing a bit of background information about the panel and the format for today's session. The presentation by Alnor Nenshi Nathu is one that was offered by the Clinical Ethics Service in Alberta in response to a perceived need within the health system. It coincided with the release of a mandatory vaccination policy for all workers in Alberta Health Services. The policy, combined with our significant fourth wave, meant a very high demand for this information. As a result, Alnor, along with several of my ethics colleagues who participated in the Q&A, have presented this material in 22 live webinars across the province. Between the live presentations and a recording that was posted on our external site, the presentation has reached over 8,000 staff. Today's session is an opportunity to share this material across the country, to see how it might coincide with some of the work that some of you may also have been doing to provide ethics education in your areas. Following this presentation by Alnor, Jocelyn Downey and Bashir Jawani will each provide us with some further thoughts for reflection. Jocelyn will offer us a more in-depth review of freedom of conscience, and Bashir will invite us to reflect upon our own roles in supporting challenging and divisive conversations like this one as members of the bioethics community in Canada. We will then have at least 30 minutes for questions and discussion. For questions, we will be relying on the Q&A function at the bottom of your screen. So please just click on that button and type in your questions, and you can do so at any point during the presentation. If you have questions specifically of a medical or scientific nature about vaccines, we will try to refer you to some trusted sources for those questions. Without further delay, I will hand these things over to Eleanor to get us started.
Thanks so much, Victoria, and thanks to the CBS for organizing this session on this important week. And congratulations, everybody, on Health Ethics Week. And thank you all for joining in the midst of your days as well. I also want to start off by saying that the presentation is actually the collection of efforts of a number of people. And so just want to acknowledge the contributions of all my colleagues at AHS. The presentation arose out of a number of discussions about how we ought to be addressing the topics that are covered in the remarks I'm about to make. So appreciate everybody's input. And I'm going to start off with just sharing my slides. So before I begin the presentation, I also want to issue a note of gratitude, and that is that we know that at the best of times, the act of extending oneself to care for another human being is a very significant and important one. And in times of crisis like the one we're in today, those acts can be extraordinary. And we think it's important to acknowledge, even if it has been said a number of times before, the significance of those acts, and to thank all of those who are frontline healthcare providers who are really defending us and who are working in addressing this war, this collective war on our behalf. So to all of those frontline healthcare providers who have been ardently sacrificing of themselves for the past year and a half and more, a very special thank you from all of us who are beneficiaries and potential beneficiaries of that generosity. I also want to start off by making a couple of remarks about what our intended objectives are here today. And they're really twofold. The first one is that we know that the discussion that we're about to have now, as well as many other related questions that arise in the public policy sphere that relate to the pandemic, have been met with a great deal of antagonism. They've been discussed with a lot of divisiveness, and it's raised a lot of emotions and anger. There's been a lot of misinformation that has been strewn around, and there's a lot of imprecision in language that has been used to discuss these issues. And one of our hopes is that by clarifying some of the language that we use to address these issues, that we collectively, as individuals who are working in or supporting the healthcare system, can help others to have more nuanced and thoughtful discussions that are therefore more productive around some of these issues. The second objective is to present a framework that can be used to think through the complex issues that face us as we're thinking about mandatory vaccination. And we present it in all humility. That is, that this is not being purported to be the only way of thinking about the issue and the only framework that's available. We know that at the end of the day, even when all the misinformation has been corrected, even when the vague language has been clarified, that reasonable people will still disagree about what the right thing to do is. And that's natural in an issue that's as complex and as difficult as this. And in fact, it's not only to be expected, but it's probably to be encouraged in a pluralistic society. But nevertheless, we hope that the framework that we do provide can be helpful in allowing people to think through in a more rigorous way how we can approach some of the issues that we're faced with, and in particular, this one around mandatory vaccination. Before I get into the meat, or what I like to call the tofu of the issue, I want to make a few contextual remarks that I hope will help to provide some background information and that will elucidate the core of the question that we're trying to answer. And the first of these preliminary remarks is what we'll call the central tension. And what we want to suggest is that the central tension that runs through this issue and many other issues that relate to pandemic ethics, whether they be around mandatory vaccination, mandatory masking, hospital visitations, social gathering visits, passports, that at the core of almost every one of these issues is a common tension between, on the one hand, the promotion and the protection of individual liberties and freedoms on the one hand, and the promotion and the protection of the public good or the well-being on the other. And what's important to note here is that we know that every ethical issue is an ethical issue because there are two or more values that are in tension that we're trying to uphold. We have two or more moral obligations, but we can't uphold both of them at the same time and to the same extent. And they become an ethical issue because it requires that we balance these two important things against each other, given the context that we're in. So it's important just to acknowledge what the core tension is so that we can proceed from there. That's the first part of it. And the second part of it is that both of these things, the protection of individual liberties and the promotion of public well-being, are instrumental in our society. And we can't jettison either of them. So the question is not which of these is important and which of these can we leave behind. The question really is, how do we balance these two absolutely critical things given the context and the circumstances they're in? And it wouldn't be a difficult question, obviously, if both of them weren't really important. And that's what makes questions like these so divisive when we do deal with them. But it's important to note that they're both important. And the challenge is trying to figure out how we then balance the two and how we can promote the two to the greatest extent possible, given the limitations. The second contextual remark that we want to make is around the harm principle. And this is a principle that, as many of us will know, was most commonly articulated by John Stuart Mill in a book on liberty, in which he says, "The only purpose for which power can be rightfully exercised over any member of a civilized community against his will is to prevent harm to others." Now, this is colloquially been expressed as my right to swing my arm ends at your nose. In other words, in a free and democratic society, most of us enjoy a great deal of individual liberties and freedoms, and those are crucial to us enjoying the quality of life that we have. But one of the limitations on us exercising those freedoms is when those particular actions result in harm or potential harm to other people. Now, we're not suggesting that this is the definitive answer to how to balance those two important and critical things against each other, but it can be a good starting point to think about how we balance harm and how we consider harm, and when harm is sufficient to justify the curtailment of individual liberties. Now, there are other reasons in a democratic society that are justifiable for restricting individual liberties, but harm is perhaps one of the most significant and serves as a very central point for us to think about balancing these two goods against each other, the promotion of individual liberties and the protection of the public good. So again, an important starting point for us to think through. The third contextual remark that we want to make is around what we'll call the myth of unfettered liberty. And here we'll use a couple of examples. The first one is something that you may have read about a number of weeks ago, and that is that there were a couple of gentlemen who submitted to the Alberta Human Rights Commission a complaint that their human rights had been violated when they were not allowed access to a Costco in Edmonton and a People's Jewelers in Edmonton because they refused to wear masks. Now, their argument was that their human rights had been violated, and in response, the Alberta Human Rights Commission, without going into the detail of the case, said that their human rights actually had not been violated. The second example has to do with the Canadian Museum of Human Rights in Winnipeg. Now, the museum also a number of weeks ago had implemented a Manitoba-wide public health policy that required all attendees to show proof of double vaccination before gaining entrance to the museum. So they were implementing a provincial regulation. And when they did so, they were met with a barrage of vitriolic and very angry comments on their various social media channels, decrying them for this action and arguing, ironically, that it was a violation of their human rights as would-be attendees to the museum. And in response, the CEO of the museum, Aisha Khan, posted something on their social media channels that we think was instructive. And what she said was that discrimination is defined in law as treating a person differently on the basis of some characteristic that goes to the root of who they are as a human being, where there is no reasonable cause to do so. These characteristics include age, ancestry, ethnic origin, sex, sexual orientation, religious belief, gender identity, and disability. We have to be careful, she says, about equating a choice not to get vaccinated with these protected characteristics when looking at what can be considered discriminatory. I think what she's pointing out here is a really important distinction between different kinds of things that some people are calling human rights. On the one hand, the right not to wear a mask, and on the other hand, the right not to be discriminated against because of one's disability or gender or religious belief. Now, we want to suggest that it's really important that we use language in the appropriate way, especially when we're talking about discrimination and human rights, and that we not erode the concept of human rights to such extent that it gets bastardized or that it gets watered down so significantly that it loses its power in circumstances where we absolutely need it. For instance, around issues of gender, disability, and all the other things that human rights have proven effective for. So as we're thinking about this and as we're involved in discussions with others, we want to suggest that it can be helpful to point out these important distinctions, and that not every privilege, freedom, or liberty is a human right. And we can't just apply that terminology to everything that we want to do and say this is a human right. There are really important distinctions to be made here. The second thing is that there is no such thing as unlimited liberties or unfettered liberties, even in a free and democratic society. We all face certain restrictions on our liberties all the time. So for instance, I can't decide tomorrow that I am no longer going to abide by the rule that requires me to stop at red lights and say, look, no government is going to tell me where and when I will drive. I will make that decision for myself. Well, why can't I do that? I can't do that because it would cause inordinate harm to other individuals were I to do that, and it would result in a rather disorderly and perhaps anarchistic society. So that's an example, and perhaps a trivial one, of a limitation on an individual liberty. But it's an example of the kinds of limitations that exist in our everyday lives and that most of us take for granted because we recognize that they're really important so that we can all live lives that aren't dangerous or harmful constantly, and so that we can live in at least a semi-orderly society. So the point there is that even the most ardent libertarian, one who espouses the principle of liberty at almost all cost, would have a hard time arguing that there should be no such thing as any kind of limitation on liberties in society. Because were they to do so, we'd end up with a society that would be extraordinarily dangerous for almost all of us. So then the point here that we suggest that we can help others recognize is that liberties are things that can be constrained even in Western democratic societies. And the really core question is not, can we ever limit individual freedoms? The core question is, under what circumstances can we curtail individual liberties for the public good? That's the root of the question that we need to try to answer. The fourth contextual remark that we want to make here is around the distinction between facts and values. And here we'll use another example. The question of whether or not a particular agent that has been used for deworming largely in animals and in some circumstances in humans can be an effective treatment for COVID-19 disease is not a question that can be resolved in the court of public opinion. Why? Because it's a factual issue, and factual issues can only be answered or responded to by looking at the evidence or research. Conversely, there are important value-based questions, such as the one we're dealing with today, which is under what circumstances can we curtail individual liberties for the public good, that can only be answered through thoughtful, nuanced discussion about how we balance the various values against each other. And it's really important in any conversation to be able to pull out these separate strands of the factual from the evaluative questions, because how we answer those questions are very different. They're two very different processes. But what we often find on social media and in other discourse is that the two strands get conflated with each other. And what results is a rather confusing mess and a complete inability to answer the question, but it's because it's not clear what kind of question it is. So one helpful thing we want to suggest is that we can support others by helping to identify what are the factual versus the evaluative elements of a particular question, recognizing and helping to point out that there are very different kinds of questions that involve different ways of answering the question, and therefore add clarity to the very discussions that we have by pointing out this really crucial difference between factual and evaluative statements and questions. The fifth contextual remark we want to make is around the definition of mandatory as we've used it here. And we want to suggest that as we're using the term mandatory here, we're not suggesting that it means immunizing somebody against their will. So we're not talking about tying people down and injecting them with a substance against their consent. We're also not talking about applying this to everybody without any exception whatsoever. As used here, rather, the term mandatory should be taken to mean that there are consequences for failing to comply with the policy. Now, what those consequences are will be different depending upon what the context is. It may be one particular type of consequence in a healthcare realm. It may be another type of consequence in a service provider realm. But either way, the term mandatory should be recognized as having different potential definitions. And a lot of the moral argument rests upon how we define the term mandatory. So it's important to recognize that here we're defining the term mandatory to mean there are consequences, because of course, if we define it the other way, there would be a significantly different moral question that we were trying to answer. So getting to the core then of what we want to suggest, it is that mandatory vaccination can be morally justified if certain criteria are met. What are those criteria? Well, first, that the likelihood of transmission of the virus and the severity of outcomes from being infected by the virus is significant and high. Two, that vaccines are effective in reducing transmission of the virus. Three, that less restrictive means have proven to be ineffective in reaching a particular public health goal. So here we're talking about such things as masking, PPE, hand sanitization, education, incentives. If it's the case that those less invasive means have not enabled us to achieve the public health goal that we're trying for, then that adds stronger moral justification of moving towards a mandatory model. The fourth is that the needs of vulnerable or marginalized populations are considered. And here we're talking, for example, about long-term care, where we know that a significant proportion of the population of workers who would be subject to a mandatory vaccination policy are from less socially powerful groups, such as visible minorities, new Canadians or immigrants, people whose first language is not English. We know that members of those groups may be less able to challenge decisions. They may be less able to change jobs should they not wish to be subject to a mandatory vaccination policy. Knowing that there is an additional obligation on any organization that's moving towards a mandatory model to try to mitigate the harms that might result, particularly for those vulnerable populations, because we know that they're particularly vulnerable in this regard. The second implication here is that there is a greater obligation to try to maximize access and minimize barriers to vaccination. So we know that there is a small component, perhaps dwindling now over time, but still nevertheless a component of the population that has not been vaccinated or been vaccinated yet because of some barriers that they might face. We often assume, sometimes in the back of our mind when we don't think about it, that people have relative ease and access to information in the same way most of us do, in terms of the information on the internet about COVID, about its severity, about the virulence. But that's not the case, obviously. We know that certain people don't have access to the same kind of information. They may not speak English and may not understand the information, or they may have other restrictions which are rooted in their socioeconomic circumstances. They may not have transportation, they may work several jobs, whatever it may be. So there is then a greater obligation on any organization that's moving towards a mandatory scheme to make sure that we're reducing as much as reasonably possible any of those types of barriers to accessing vaccination, so that we're mitigating those types of harms. The fifth criterion is that harms arising would need to be mitigated. Now, we know that in some very rare circumstances, there are adverse events and reactions to the vaccine. And knowing that, there is then a heightened obligation to make sure that when individuals in those rare circumstances do have such adverse reactions, that we're doing everything possible to restore them to their previous state of health. And the last one is that exceptions would need to be considered on human rights grounds. And this goes back to what we were discussing earlier, which is that there are certain characteristics that go to the core of who we are as human beings. And so we would need to make sure that we're considering any justifiable exemptions based upon human rights. So what we want to suggest is that all of these criteria, when looked at in totality, are criteria that, if met, would justify mandatory vaccination. If we know that transmission is very high, that the severity of the disease is great, we know that vaccines itself reduce transmission, we know that other attempts to use less invasive and less restrictive means have not been effective, we're making sure that we're mitigating harms for vulnerable populations and any harms arising from the vaccine, and we're considering any justifiable exceptions, then mandatory vaccination may be justifiable on moral grounds. But we want to add another layer to that, and that is to suggest that there is a heightened obligation for certain individuals and certain professions or groups of people to make sure that they are protecting others from harm and promoting their well-being. So consider the following kinds of circumstances. One, where the frequency of contact with others is high, as there is with most service professions, where there is some risk of harming others because of that increased frequency of contact, where others might be at a heightened risk. So we know that's the case in healthcare, for instance, where there are certain kinds of patients who are at greater vulnerability because they may be, for instance, immunocompromised. There are circumstances where there is a fiduciary or a professional obligation to others' well-being, which also is the case in healthcare. We know that this is something that is rooted in every health professional code of ethics, that there is an obligation to promote the well-being of one's patient, and also there is an expectation and a relationship of trust. That is, that patients and clients in the health system trust that their healthcare providers will do everything possible and reasonable to promote their well-being, and certainly not to harm them. Where there is that expectation of trust and that fiduciary obligation, there is also then a heightened responsibility and a moral obligation to ensure that we're not harming the individuals who put their trust in us. The next circumstance is where patients and clients have fewer choices. So for instance, if somebody has a heart attack, they have very few choices about where they will go for care. And that imposes a greater obligation than if somebody is going out to buy some cauliflower, for instance. Or the next one is that patients and clients are entitled to the same level of care and low risk of infection. So here we're talking about the fact that we don't want patients or clients to have to worry about whether or not their particular healthcare provider is vaccinated or unvaccinated. Rather, we want to provide the same level of equitably safe care to every individual and not have to subject them to the lottery of healthcare provider vaccination. And the last one is that where individuals are involved in providing an essential service. Now, we know that healthcare is important at the best of times, but that in the midst of a public and global health crisis, it's absolutely critical and essential. So as a result, it's important to make sure that those who are running and providing that service are taken care of as much as is possible, and that we promote their health, not only because they're human beings and we value them individually, but also because they're important to keep an essential service running in the midst of a crisis. So what we want to suggest is that, again, the totality of all of these circumstances, all of which prevail in healthcare, we want to suggest, heighten significantly the obligation of those who are working in the health system and those who are healthcare providers to make sure that we're not harming the individuals who come under our care, and to make sure that we're doing everything possible to limit the transmission of the virus and therefore not harm others. So that's the core of what we wanted to suggest. And in summary, what we've said is that the prevention of harm to others can morally justify curtailing individual liberty, that liberty, when it is curtailed, should be curtailed to the least possible degree to achieve the public health goal that we're aiming for, that it's important to consider any justifiable exemptions, that healthcare providers have additional obligations that go above and beyond what individuals in other professions or in other sectors might have, and that any restrictions on liberty that might be imposed, such as under a mandatory vaccination scheme, impose additional obligations on the organizations to make sure that they're mitigating harm and decreasing any barriers to accessing vaccination. That said, I want to step back in the last comment and offer a bit of a critique, perhaps in true philosophical form, of the very framework that I just have suggested. That is, that we know that we live in a society that highly values individual liberty and choice. And we want to suggest that that's the way it should be. The promotion and the protection of individual liberties have granted us enormous amounts of benefits and contribute significantly to the quality of life that we enjoy. But we want to suggest that perhaps that can sometimes come at the expense of a focus on the question of how we can advance the interests of others. And there's really two subpoints here. The first one is perhaps a factual claim about the way the world is. We know that something that happened in a series of events that took place in either a marketplace or in a laboratory in China a year and a half ago has had massive implications for over 8 billion people in the world. We recognize that what happens halfway around the world has impact on us or can have significant impact on us, and that our lives are intricately connected to each other in a way that perhaps wasn't true even several decades ago. And they're inextricably intertwined, such that even if we were to say to ourselves, look, I will act only in such a way that advances my own self-interest, I'm not going to be worried about the interests of anybody else, we would be undermining ourselves if we didn't consider the well-being of other people at some point in time, because of the nature of the way the world is and the nature of how our lives are so inextricably connected to other individuals. Now, that's a statement about the global connection in the world we live in. And the second point is a broader, more philosophical one. And that is the suggestion that the way that we look at the world, the way that we balance these competing tensions of individual liberties and the public good, as we have in Canada, for instance, over the past year and a half, obviously has great implications for how we answer the question. And we know that this has been very divisive, that it's been very antagonistic. But perhaps, if we had looked at the question slightly differently, if we had phrased the questions in a way that asks, for instance, what's our collective responsibility to each other? Or what does it look like to live in a caring community? Those are very different ways of asking that question, as opposed to when can we curtail individual liberties and rights? And so perhaps if there was just a little bit less emphasis on individual liberty and choice, and a little bit more focus on the question of how we can live in a community in solidarity and in support of each other, perhaps we'd be in a slightly different place than we are now. Now, many might say, okay, well, perhaps that's a useful reflection, but it really doesn't help us in the midst of a crisis. And I think that's very true. But crises are also opportunities for us to step back and think about how we got here in the first place. And there are opportunities for us to think about post-pandemic, the kind of life we want to lead and the kind of society we want to be. And perhaps by reflecting back and thinking about whether or not that balance that we currently have and that focus that we have on individual liberty, thinking about whether that's the way that we want it to be going forward, we might be able to, if we think that we want to adjust that balance, we might be able to approach the next pandemic when it comes in a slightly different way than the rather divisive and antagonistic way that we have approached this one that we're in the midst of. Now, I know that that's raised a number of questions, and we'll have an opportunity to discuss some of those, but I'm going to pause there and turn it over to Jocelyn for her wisdom as we move forward. Thanks.
Thanks very much, Eleanor. I am going to share my slides and get started. There we go. Okay, well, good afternoon, everyone. I'm grateful for the opportunity to participate in this session. It's actually wonderful to be back with the CBS-SCB community. My role today is to talk about proof of vaccine policies. Note, I won't be using the language of mandatory vaccines, really for the reasons that Eleanor set out. He flagged them, and I think it's actually really important to reject that label. But I am talking about the same thing that Eleanor's been talking about. And I'm going to be taking a slightly deeper dive into conscience. Now, at the outset, it's important to note that looking at conscience here, and then the way I'm going to, doesn't change the conclusion that proof of vax policies are legal and ethical. Human rights commissions across the country have made statements to this effect. Legal academics have opined. Many bioethicists have come to the conclusion, myself included, that they are both legally and ethically defensible, of course, assuming that they are time limited, they are privacy protective, and so on. But raising the issue, I think, catalyzes some important conversations. So the first, it provides the opportunity to explain and explore human rights law. Eleanor talked about these somewhat in the specific, and I want to pull us back, the gaze back a touch, to be a bit more general, because I think the public debate about these policies has shown a lack of understanding of human rights law in Canada, and bioethicists will do well to understand it themselves and also to be able to bring it into the conversations in a meaningful way. So let's have a quick look at human rights laws. They provide protection from discrimination. Note the limit on scope. It's about discrimination. It's not liberty, it's discrimination. It is in relation to employment and housing and services and so on. So again, there's a further limit. That's all it's relative to. It is only on the basis of protected grounds. So again, an even further limit. There's only certain things that you can't discriminate against in relation to certain services and activities. Now, there is a duty to accommodate, to make it possible for the person to not have to do, for instance, have a vaccine if that's the policy in question, but that's only to the point of undue hardship. And so that's a significant final limit that you actually are able to discriminate in relation to on the basis of a protected ground, where accommodation would be an undue hardship, where it would be impossible to accommodate the person's wishes. It's important to understand also what the protected grounds are for human rights legislation. Certainly disability is in all of the human rights codes and acts across the country. Religion is in all but one, and the one that's not in is in Ontario, and that's because it's actually covered in another piece of legislation. So religion is actually also covered everywhere. Creed, interestingly, is only in 10 of the 14 being all the provinces and territories and the Federal Act. Conscience is in none. And personal preference or singular belief are not in any. That's not protected under human rights legislation. And that's in part why so many of the challenges to the policies have actually failed. So that's the core information that's important to understand there. The second thing that that looking at conscience in the context of these policies gives us is an opportunity to explain and explore the Canadian Charter of Rights and Freedoms, because again, people don't necessarily understand what it applies to, what its scope is, and so on. Well, the first thing to understand is that it applies only to state action, only to state actors, so the government and those that the government has delegated responsibility to in a certain kind of way. So it's not your boss, it's not an individual. You can't take an individual to court with a charter challenge. They don't have charter obligations. The charter also establishes a limited set of rights and freedoms. Now, it does include freedom of conscience and freedom of religion. Both of those are in there. And it also protects equality and includes within the equality provision religion and disability, just as we saw in the human rights legislation. But again, the rights and the freedoms can be limited if it is, and this is the language of the charter, demonstrably justified in a free and democratic society. It's important to note, especially the minimal impairment element of demonstrably justified, because this is where you get into saying, okay, well, if you could achieve the goal of the legislation, which may be the policy, I should say, is minimizing infectivity. If you could achieve that by saying either you provide proof of vaccination or you provide proof of a negative test yesterday, then if you didn't allow proof of negative test, you would not be minimally impairing the right. So we can see that there are protections, but there are limits, and there are ways in which the government action, the state action, is constrained to minimally impair rights, but the government is permitted to impair rights. Clearly, we are balancing in this context, to pick up the language from Al Noor, when we do a charter analysis or human rights analysis, you are looking at individual rights, but it's not just the individual who's in front of you. It's other individuals who have rights and freedoms and interests that are affected by the exercise of the individual who's in front of you's rights. Now, I would note here before moving on to conscience specifically is there will be very few breaches under the charter as there have been under the human rights legislation, because there are actually very few medical reasons for not getting a vaccination, and there are even fewer religious grounds for not getting vaccinated. And then also, again, as with the human rights, even if it's breached, these policies will be saved by Section 1, as long as they're carefully crafted, because they are serving such an important pressing objective, can't be realized in other ways, and the policies presumably will minimally impair the rights that are impacted. Okay, so the third opportunity we have here is an opportunity to reflect on conscience. Strikes me two questions are really key. Why is it not in human rights acts and codes in Canada? Remember I said religion's there, creed's mostly there, but conscience isn't there. And what does it mean? Well, why is it not a protected ground? I don't actually know the answer to that question. I wonder whether it's because of the presence of the concept of creed. And people think, well, we've got religion and creed, so conscience is there, but creed is not the same thing at all. While it's not really carefully defined, we do know that it has this definite religious overtone. Sometimes it's defined tightly in connection to religion, but certainly it is understood to relate to religion, or what some people call secular religion. It's the notion of a comprehensive overarching system of belief. It's dealing with ultimate questions of human existence, about the existence of a creator or a higher order of being. And they look for a nexus with an organization or community that professes a shared system of belief. So that's quite different from conscience. Another reason might be that it's just a reflection of the historical privileging of religion. So in as much as creed is related to religion, you're getting both of those together. And because we privilege religion, we're going to have creed in there, but we're not going to have conscience in there because it isn't religion. I don't know, but I think we should look into it. Next question, well, what does freedom of conscience mean? It's not defined in the Charter. The case law and the legislative history is not helpful at all. Basically, what you find is some judges saying, well, religion is prototypical of conscience, so religion is subsumed, it's an example of conscience. And some of them say it's clearly distinct categories. And then some of them say both of those things in the same judgment. So truly, it's not very helpful. So I think it's useful to look to philosophy. I can't do any justice to looking to philosophy here, but I'm going to share just a few thoughts that I worked up with Françoise Bayless in a paper about freedom of conscience and the Charter that I think might be helpful for the discussion period. So I think you start with, what's the purpose of protecting conscience? I think it's because we want moral agents. Society wants and needs active moral agency amongst its members. We want individuals to take their moral responsibilities seriously, and this is because we see that as serving the well-being of individuals, gives them a sense of integrity. You're not in conflict with yourself. You're not being told to experience the harm of self-betrayal or a loss of self-respect, which comes from not being able to follow your conscience. Arguably, people are treated better by those who are exercising conscience, this desire to find what is the right and the good. Arguably, we find better interpersonal relations, although I would say not always, of course. Protecting conscience also, I think, serves the well-being of society. Society survives, indeed flourishes, when conscience is treated seriously and protected. And it also survives and flourishes better when we have a dialectic about ethics where we are engaging with each other about issues from the perspective of what does our conscience suggest we can and should do. We deliberate about what is right and wrong, and we may get to better answers about what is right and wrong. So if that's the purpose, then I would argue that conscience should be given protection, legal protection, when a person's conscience claim has a nexus with specific ethical values, beliefs, or commitments that recommend or demand a particular act. So nexus with ethics, that they are sincere in their ethical values, beliefs, or commitments, not just pulling it out of the air. Otherwise, I think it's just liberty, in which case we should do a liberty analysis. But if you want it to be conscience, it has to be about these elements. And then I also think the conscience claim has to be the result of an exercise of ethical judgment that results from two things: an exercise of due diligence and the avoidance of undue deference. These trace back to this concept of wanting moral agency. And so this kind of engagement and exercise with judgment is a part of agency. This makes it different from religion, I would note. We can come back to that. I would say the state action must also interfere with the freedom to act in accordance with the ethical values, beliefs, or commitments. And the interference must be grounded in the ethical values, beliefs, or commitments. That interference must be more than trivial or insubstantial. So I'm going to conclude by noting that I think the challenging proof of vax policy discussions combined with reflections on conscience have a silver lining. They present opportunities for bioethicists. I think that if someone makes a claim that proof of vax policy is illegal or unethical, unless it has a conscience exception, it gives the opportunity to discuss human rights legislation and explain how it works and how probably the policy is not actually illegal or unethical. It gives the opportunity to discuss the Charter, again, explaining what its limits are. And it gives the opportunity to explore conscience, which serves actually the purpose of protecting conscience, which is this notion of enhancing moral agency and engaging people in moral agency. I think it also helps to diffuse proof of vax policy disagreements, because I think when you talk through the human rights legislation and the charter, people can come to see how it's not a breach of their rights or their freedoms. And I think really importantly, I hope, it lays a foundation for future discussions of freedom of conscience in the bioethics context, because there are many, many issues in which conscience is relevant. And I don't think we've actually done enough really robust reflecting on the concept of conscience and how it plays out in a whole variety of bioethical issues. So with that, I am going to turn it over to Bashir.
Thanks so much, Jocelyn. I'm honored to be with all of you here today and to share the screen with Elnor and Jocelyn. I'm going to, in the time that I have, talk about our role as ethics leaders, and I think that's almost all of us, whether we're bioethicists participating in this conversation or not. I might say especially as bioethicists, but I do believe all of us, in supporting some hard conversations as members of society, like the ones around mandatory vaccination. Jocelyn, I take your point about the language. The first thing I want to point out is that no matter which way we balance the values that we have talked about so far, that Elnor and Jocelyn have elucidated, it's going to be an allocation one way or the other of some harms and some goods in society. In other words, whatever our policy is, whether it is some kind of proof of vax or mandatory vaccination on the one hand, on pain of losing access to an important good like school or work, or whether it's completely voluntary or there's some other version of it, it's going to distribute goods and harms differently, and it's going to then be controversial. So we could be talking about the other side, a policy of just pure voluntary vaccination, and it's also going to be raising questions appropriately. And so I want to point out then that this question of what policy we should actually have is only one part of the broader question of what our approach to vaccination in society should be. And that there are some other really important dimensions to this question that we also need to think about. Who should be doing this analysis and making these decisions? Who should be consulted along the way? How should the decision be communicated, whatever policy we end up on? And then how should this be implemented? And I want to suggest that each of these questions, requires its own careful analysis of values and evidence. My observation is that we often focus on this second question. Well, what's the policy? What's the right policy that we should have? And I want to suggest that actually these other questions 3 to 5 on my list here on the left, are actually underexplored and really important to explore, because they concern how we are together. They concern this idea of citizenship, of what it means to be Canadian, what it means to belong to Canada. And I want to urge that we actually explore these other questions a little bit more. Because whichever policy we end up choosing, we have to live together. And I think this has been really beautifully articulated in this passage from Grand Chief John Kelly in 1977, where he writes in a submission to a Royal Commission that it also appears that as the years go by, the circle of the Ojibwe gets bigger and bigger. Canadians of all colors and religions are entering that circle. You might feel that you have roots somewhere else, but in reality, you are right here with us. I do not know if you feel the throbbing of the land in your chest, and if you feel the bear is your brother with a spirit purer and stronger than yours, or if the elk is on a higher level of life than is man. You may not share the same spiritual anguish as I see the earth ravaged by a stranger. But you can no longer escape my fate as the soil turns barren and the rivers poison. Much against my will, and probably yours, time and circumstance have put us together in the same circle. So the fact of the matter is that whatever our policy is on this particular issue, we have to live together. We have to find our way through together, which means we have to think about what matters in the way that we negotiate these hard questions together. And so we can point to the importance of interpreting and strengthening some key values when it comes to citizenship. Things like public spiritedness, a search for a common good, justice historically and in the future, civility and inclusiveness in the way we talk about things, solidarity and community as we work through things, and ensuring a sense of belonging that we can share as we move forward. These are the kinds of things that we need to think about protecting and interpreting and strengthening as we figure out how to navigate some of these hard questions that we inevitably have to sort out as society. And the fact of the matter is that we face some really important threats to this social cohesion. I'm getting a phone call, I apologize. I muted that. So some of the tension, the threats that we face include things like increasing inequality in society, communication challenges, just from sheer volumes of information, to information that's of marginal relevance, to misinformation from people who have the best intentions, but who are communicating information that's not accurate, differences in language, to undermining of truth, where we've seen where intentionally spread inaccurate information colors or filters into the debates and the discussions that we have. Growing intolerance in society, fear of the other, greater migration, greater diversity in other ways. There are a lot of threats that we have to face in terms of social cohesion that we have to figure out how to resist. And our role, I'm arguing, as bioethics people and ethics leaders, is to figure out how do we actually constructively do that. And it's clear that these fissures that are being created are manifest in the COVID experience we're having. I'm just thinking about, we've been spending a lot of time talking with folks in acute care these days. And some of the stories we're hearing are interesting, with this experience of division, right? Where the stories we hear are care providers telling us that at the beginning of the pandemic, there was this sense of cohesion, of social solidarity. It felt like we were in this together. Everybody was willing to do their part, whether it meant staying home, practicing social distancing, wearing masks, whatever it was, we were willing to do it. And we recognized, healthcare providers are saying, that the special role that healthcare providers play in keeping individual people who are sick safe and protecting the safety of the broader society. And then all of a sudden, fast forward a number of months, and it feels very different. It feels like we're in different camps. There's division in society. The people are actively working against coming together to solve this problem, for example, by not getting the vaccine. That's what it feels like. And healthcare providers, and the ones in acute care that we talk to, are reporting, getting screamed at for doing things that are trying to help individual people and the broader society to get through this COVID experience while being exhausted, extremely fatigued, and under-resourced. So they're feeling the division in society is manifest in the experience that some of our people are having. Now, we have to figure out how to get through this, because as Adrienne Clarkson wrote or spoke about in her Massey lectures in 2014, she said, we cannot create a civil society by including only the people we like and with whom we share similar interests and goals. That's called friendship. And a society, a country, is more than friendship. Our true strength will come in building a good society, not only with those whom we like, admire, and share values with, but also with those whom we do not like and whose values and inherent beliefs are different from our own. So we have to find a way to get through this together. So what's the role of ethics leaders and bioethicists in this? Well, I'm suggesting focusing on some of these other questions that are part of the policy discussion around things like our approach to requiring vaccination. So in terms of thinking about who is consulted in this decision-making, we need to support deep listening to multiple perspectives and inclusiveness in that consultation of making those decisions. In terms of communication, we have to encourage communication of reasons and a communication of reasons that anticipates the kinds of concerns people will legitimately have, and sort of counter arguments to those reasons, at least in defense of whatever policy we end up having. And then that communication has to be accessible to the diversity of the community that's impacted and with whom we need to partner as we try to go through this. And then we also need to provide support in the way decisions are implemented. We need to provide downstream ethics support. In other words, when we make a controversial policy decision, the reality is that the integrity of some people who are impacted by that will be compromised. And how do we think about that compromise and support those folks to actually get through that and make meaning of their lives in a way that allows them to work together with others through this? And so I'm going to end with just a concrete example of this implementation and downstream support point that I'm making, asking the question, okay, so we have in some provinces, we have a mandatory vaccination program, a policy for healthcare providers, so that if you're not going to get the vaccine, then your employment will cease, and that's the way it's going to be. This has to be enacted now. So the question becomes, one of the questions is, how should leaders speak with their employees, their staff, colleagues who are hesitant to get vaccinated? How should that conversation go? What should that conversation look like? And, you know, as we've been looking at this, one of the things I've noticed is, and it's kind of irking me, is that, you know, my colleagues in HR will use this language of termination. And these are really kind and caring people who are trying to serve the community, the organization as well as possible. But this language of termination has come in so that the idea is that, well, if you don't get the vaccine, then you're going to be terminated. That's actually the way it's talked about sometimes. And this makes me recoil. This metaphor is extremely powerful and problematic. First of all, no one's getting terminated unless there's some version of the Squid Game going on that I'm not aware of. If you choose not to get a vaccine, you're not going to get killed. You're not going to die. You're not going to end in any way. You're going to continue. Not only that, but our relationships aren't going to get terminated. While it's the case that we may no longer work together, I'll probably see you at the grocery store, or 6 months later, we may work together again when the context looks a little bit different. Really what's happening is that there's a choice being made such that employment is no longer going to continue. We're making choices to preserve our own well-being, whatever that looks like for each of us as human beings, as individuals. And so we have to say, okay, that's the reality of the world we live in, but how do we continue to live life together, to get through this together, which we inescapably have to do. And I think that kind of support is one of the areas downstream, a very small, simple example of an area that we actually can provide important support with people in thinking about and actually doing. So I'll leave it with that, I should say, and stop my sharing and invite Victoria back.
Thank you very much, Bashir, Jocelyn, and Elnor, for such a great grouping of material to start us